So, again, welcome to Prepared and Empowered Action Planning for Chronic Health Conditions in OST. We are so happy that you are here today. My name is Claire Grace Jones. I'm part of the Collaborative for Advancing Healthy Experiences in Out of School Time. I'm on the team as well as a mom who has a child with a chronic health condition. Also with me today, we have Kate Goddard, our project director, Bianca Reed, another training and TA specialist, and Anna Borer, who is our amazing behind the scenes, all things tech and Zoom for us today. So I just want to tell you a little bit about the collaborative. We facilitate trainings, we bring out of school time professionals together to learn from each other. We curate and create resources, and we foster partnerships to sustain practices that advance the well-being of youth and staff. And today's agenda, we're going to look at this. We're already sort of checking off the first one with welcome and introductions. And we're going to jump into some tools and resources for action planning pretty soon. We'll talk about some best practices for engaging youth and families and staff supports, give you some additional resources, some reflections, and how you can stay connected and provide some feedback to us. But first, I want to hand it over to Kate to kind of set the stage for us a little bit.
Great. Thank you, Claire Grace. And thanks everyone for taking time out of your day to join us today. We're so excited to be here with you all. As Claire Grace mentioned, I'm Kate Goddard. I'm the project director for the Collaborative for Advancing Health Experiences and Out of School Time. More importantly, I am really excited today to showcase our new interactive resource, which if you haven't seen it, Claire Grace is going to dive deep into the resources and tools in it, but it's a strategy guide that's focused around supporting youth with chronic health conditions and out of school time. So we're going to, like I said, we're going to dig into it and showcase lots of the materials from that in a few minutes. But I wanted to take a moment before we do that to set a little bit of the stage here. So when we're talking about chronic health conditions, we are broadly defining that as health conditions that last 1 year or more and require ongoing medical attention or limit activities of daily living or both. So in today's webinar, we'll be referring to the most common health conditions, which are asthma, allergies, diabetes, and seizure disorders. But we recognize that there are many other conditions, and the resources, strategies, and tools we'll be reviewing apply to all of the conditions. So when we are thinking about supporting youth in out-of-school time programs, it's important to remind ourselves that many of the youth in our programs have chronic health conditions. We may not know of them, right? So let's consider some of these national facts. Over 40% of school-aged children and adolescents have at least one chronic health condition. So given that we know that over 7 million youth participate in out-of-school time programs, that means just then less than half, so over 3 million, may have a chronic health condition. So the magnitude of this number represents the challenge for OST programs in ensuring safety and addressing the potential emergencies. But it also provides some opportunities to build meaningful relationships between out-of-school time programs, our programs, the school partners and medical and health providers, as well as engaging our families and youth to develop skills and habits for lifelong health. So what are some things to consider when we're thinking about addressing the needs of youth with chronic health conditions? So here on the slide, you can see the Centers for Disease Control and Prevention has published this free resource. And while it's targeted for school settings, it applies to any program working with youth. And it outlines key steps programs can take to address the needs of youth with chronic conditions. So again, you can see it on the slide here. And I think for many of us in or out of school time, the most likely thing we consider is providing a safe space where youth can engage in physical activity opportunities and have access to nutritious snacks and meals. I think it's also really important for us to be mindful of providing a safe physical environment. So for instance, youth with certain chronic health conditions like asthma may have increased sensitivity to their surroundings. So providing a safe environment both outside and inside your program, includes ensuring proper maintenance, ventilation, and limited exposure to pollutants. So we also wanted to, when we think about providing a safe space, we also think about promoting a positive climate where youth feel safe and a sense of belonging, and can seek guidance from trusted adults. And again, I think this is where we all in OST really thrive and excel. I also think it's really important for us to think about how we support our staff with meeting the needs of youth with chronic health conditions. And oftentimes this is done through training and professional development. So think about providing ongoing training so staff feel confident managing and responding to emergencies, or trainings that cover chronic health conditions and go in deeper around system recognition and required accommodations and the emergency procedures that need to be followed. And I want to pick up on that because creating emergency protocols and policies that help staff feel confident and understand the signs and symptoms of chronic health conditions is so important. And so later in today's webinar, Claire Grace is going to introduce a number of resources and tools that really help with that, putting action plans in place and identifying key things so that when an emergency happens, all staff feel comfortable in a response. And then also just being mindful that when we're thinking about supporting youth and managing their care, centering them in the discussions around that, and helping them build opportunities to learn self-management skills, such as how to recognize their own symptoms and how to use medication correctly, is another thing to be thinking of when we're talking about this topic. And then, of course, supporting the coordination of care is a critical role that out-of-school time programs can play. So we often find that as out-of-school time providers, this can be challenged given the variety of different settings we operate in. Sometimes we have limited access to information and resources, and oftentimes the need to communicate and coordinate among all these different partners can feel burdensome. But I do think building effective communication pathways among our youth, our families, the schools, our program staff, health providers, and community providers is one great first step in that getting to that coordination of care. We'll go to the next slide. Great. Thank you. And so I already talked about this. So we've talked about ways to provide a safe environment so everyone feels safe in your program. And so just wanted to also kind of dive in a little deeper, some things to be considering when we think about that. So again, most out-of-school time programs are seen as places where youth can go and receive healthy snacks and healthy meals in their programs. So just being considerate of how we are making sure that we're labeling foods that we're providing information to families and youth about the food that is being prepared, and being really considerate of food allergens and other needs that youth may have when we're planning for our healthy snacks and meals. The other thing to think about is how to make sure that we're building in physical activity opportunities that all youth can participate in. And again, centering youth in decision-making around what those activities are and helping to plan those activities is one way to think about how to plan for and ensure that all youth can participate in the physical activity opportunities you have in your program. And then finally, we wanted to highlight that there are many national and state standards, as well as existing local wellness policies and health policies that you can draw on to really help inform your plans in ensuring that you're creating a safe environment for all youth. There on the screen, you can see that the National After School Association has the healthy eating and physical activity standards for out of school time. If you've been on an event with us before, you have heard about them, and I'm sure many of you use them in your programs. But I just wanted to call out, if this is something new to you, they have an entire section of their standards dedicated to nutrition and physical activity. So if this is a new concept for you and you're looking for some examples of standards to point to help guide your planning, definitely check out that resource. And Bianca just posted the link to that in the chat. Okay, well, I know this room is a host of expertise. So Claire Grace, let's go to the next slide. And now we want to hear from you all, because again, I know all of you are coming in with your own experiences, your own ideas, your own best practices. So we're going to play a little bit of a activity here. I'm going to read a scenario, one that will probably feel very common to many of us. And then after the scenario, we're going to open up the chat to really hear from you all, your experience with the similar scenario and your ideas. So here's the scenario. Maya is a 12-year-old who recently started attending your out of school time program. She didn't have any health conditions listed on her registration form. During snack time, she eats a granola bar provided by the program. A few minutes later, she tells a staff member that her mouth feels tingly and her throat feels weird. As staff begin to ask questions, Maya mentions she has a nut allergy and usually carries an EpiPen, but she does not have it with her today. She starts to look nervous and her symptoms seem to be getting worse. So staff quickly realize that they were not aware of her allergy and are unsure of what steps to take, who should respond, and how to handle communication with the family. So that's our scenario, probably one that folks can relate with. I know one that I relate with because I had a very similar experience when I was running a program. It wasn't a food allergy, it was an animal allergy, but we'd love to hear from you all around what are your ideas for what systems could be put into place to avoid a similar situation in the future? So what are some things that as a program you could put in place so that this same scenario doesn't happen again? And then also what are some things that can be done to increase the staff's confidence in handling a situation like this? So what are some things to be done in advance, and what are some things that can be done overall to increase staff confidence, so that in a situation like that, they're prepared? And what are the things we can do to make sure in the future everyone's prepared for this scenario? And we're going to point you to the chat. Share your best practices, share your own experiences, any ideas that come to mind for how to avoid this situation.
Well, Kate, we have two people who have their hands up.
Oh,
We have
great.
Andrea, so I'll let Andrea go first if we can unmute Andrea and go ahead with your question.
Let's see, Andrea, we're going to ask you to unmute. I'm going to do that right now.
Hi,
Hi.
can you hear me okay?
You're a little broken up, but go for it. I think we can hear you right now.
I'm going to try and do my best. Good afternoon. My name is Andrea Hurtado with Primetime Palm Beach County. Um, we, I believe that it is an encouraging practice that even though documents sometimes don't have what we need, putting a plan in action during staff meetings so that when we can discuss common, concerns, worry, things that we have experienced in life always gives the staff a sense of purpose, but awareness. So having those conversations, hey, what is something that you experienced in your life that you weren't, were aware about growing up, and as you got older, you experienced or saw it happen. So that way the conversation is put in practice. Following up with the line of communication, there is a very quick basics of first aid, right? That before we shut down, we have people having roles. So if the director is the one that notices or the staff is that one that noticed, you respond by, letting your head lead know, hey, I think we need to call 911 because the more time is passed, the longer that severe occurrences can occur. So the other thing that came up in the staff meeting is like, what is their projected plan? Because a lot of people either shut down or respond a little too worried, which then causes the mass hysteria of children. So one team that I worked with not so long ago created a plan actually in front of me saying that if things like that were to happen, they would have a designated individual close to the proximity to escort the kids out of the area so that individual who saw it the closest would be able to respond first, because 911 has to be called first. And then, of course, you kind of have to go backwards by addressing it to the parents. And the only reason why I say it that way is because in this scenario, the document did not have it posted versus you would be able to call that once. Notification of the parent and then calling 911 as well. Thank
Yeah.
you guys so much for letting me share my thoughts. You can mute me now.
Yeah,
Thank
it's
you.
great. No, I love that those responses. Thank you so much. So many good ideas there. I really appreciate the idea about providing space and time for staff to connect around their own experiences and learn from each other from their experiences is so important, and creating a safe space for that is so important. And then to your point, Andrea, really just focusing also on just the basics, having first aid training, having documented protocols. But I really appreciate also the point about understanding how to stay calm in the situation and not escalate it. So I think all really important things to address. We're going to come to you, Miley. I think we're going to give you the ability to unmute. I'm going to do that right now if you would like to share.
Yes, it's Maylee.
Oh, Bailey. Great. Thank
Yes.
you for correcting me. Hi, nice to meet you.
Hi, how are you? I like what you just said earlier. This team does have to reconnect and discuss about the lessons learned of what happened. Also help them to calm their nerve down as well. I guess, we could all do training every year on the first aid, but very seldomly, which is great that something does happen. And when they have to use their knowledge, they kind of like, in shock and everything. But again, with the allergies, it kind of range. And we all see that, right? It kind of ranges. It could be very mild, which is like you say, this child could have a mild, like itchy throat because she noticed that. Um, but you want to see how quickly that is. That one of the things I've learned was that if they already notice and they have to stop eating, quickly drink water, call the parents. The parents need to know because we didn't know about it, right? They think you observe them, keep on letting them to drink, kind of flush it through, like they said, kind of flush it through, hopefully. But because once you call 911, the emergency and everything, and nothing really an emergency at that point, it's kind of like a toss. You have to monitor. And sometimes children, including when they're 1 year old, this is a time to explore food. And that sometimes happened. One of our kiddos, it is a snack, and all of a sudden had like red dots popping up in the body and everything. And the teacher kind of panicked. It's like, oh, what happened? It's like, and what was happened before? What did he eat? Because it does react quickly, as we all know, right? Allergies. So I say that's an allergies. Let's let him drink. Let's wash it off. Sometimes because it could be some kind of dust that go into your face, your skin. That also causes that skin allergies. So I say just kind of wipe it through, see what it is, give him some water, and let the parent know.
Yeah,
And the next time when you have it, just give a small piece, see if this is the one that's causing it, because we need to identify which one causes.
right,
Is it the
right.
color of the snack that he received? So again, as a baby, they're exploring food during that time. Exploring, sometimes, okay, oh yeah, they had it before. Yes, it's allergies is funny. You
Yeah,
could not be, allergic at one point, and all of a sudden, boom, there you go, smack in your face. You get allergies, but then later, a couple of years later, you're okay again. You
right.
know,
Yeah.
it's an
I
on
think
and in and out kind of thing.
well, and you're also yeah, thank you. Thank you for sharing. I appreciate you coming off mute and sharing that example. And I think you've touched on so many things there. One is that we don't have control over every setting, right? Whether or not you're a 1 year old and you're exploring food, or you're in an after school program and someone else brings a snack in, you're not always going to be in control. And so really being able to recognize the signs, but also documentation so that in the future there's a record of what is happening and what the reactions were. So I think that is such a good real example of how this can play out in a program. Um, and I'm scanning the chat right now, and there's so much in there about having documentation from registration, utilizing protocols, having processes in place. Um, I'm scanning, there's a lot, having some better intake questions. And so I think these are all really, really important pieces that we can put in place to really ensure that we're keeping our youth safe in our programs, that we're documenting incidents for the safety of the youth and for the safety of our program staff and for the safety of our organization, right? Being really clear on the documentation and communication so that everybody's well informed and everybody feels safe in the scenario. And then just having really good processes in place so that everyone knows what to do when when a situation happens. So that all leads up to a very good lead up for me to turn this back over to Claire Grace, because we have a lot of tools and resources to do just this, to help you set up those protocols, those processes, and to put action plans in place. So, Claire Grace, I'm going to turn it back to you.
All right, thanks, Kate. We are so excited about our new interactive resource. It includes strategy guides and resource lists. There's links to toolkits and all kinds of other materials. What I love about it is it's really easy to navigate. You can just click on the arrows to get to the section that you're most interested in. And so, as Kate said earlier, we really, for this time today, are drawing on what is included in this resource as far as action planning and getting to know a little bit about some of the different chronic conditions. And so, we really encourage you to go and check it out. I'm curious if anyone has already taken a look at it. We released it not too long ago, but we did share it at the National After School Association convention and in a couple other places. So if you have seen it, if you want to drop an emoji in the chat, or you want to tell us a little bit about what you thought of it, if you've had a chance to check it out. And we're going to talk in this section about tools and resources. We wanted to really be able to provide you with some actionable things that you could leave with, that you would then have access to. So, starting with identification, supporting youth with chronic conditions really starts with identification. And the key is to identify them early, if possible, as we just heard. And so, doing that during enrollment, setting up a time that you can be having some initial interactions with parents as you're doing intake, or you set up a family interview with them, conversations with youth and with families at that intake, but as someone I shared in the chat, but also ongoing, so that if something new emerges, if something changes, you want to really set up this environment where youth and parents will feel that they can trust you, they will feel comfortable, so that if they have new or additional information, or maybe something that wasn't caught or shared right at intake, they're going to feel comfortable to come to you, come to your staff, and share that. And so, again, there's lots of different times and ways that you can do this. We're sharing here an example of an individual plan that would be filled out at intake that I found with the link. It's from Medfield's after school program here. One of the things I really like about this is they actually also specifically ask for parents to attach a copy if there's already an existing health plan or action plan. Maybe they have one at school and the parent has a copy of it, and so they are able to share it directly because it's their child's information. Then that's a great jumping off point for you to start with. Once you've identified that youth have a chronic condition, it's really important, as we've heard, to have a plan. And a place to start with that is with action plans. And the good news is that there are a lot of examples and a lot of existing templates that you can draw from. We're going to take a look at a few examples today for some of the most common conditions that Kate mentioned that we find for youth. And I'm gonna just click onto our, and so each one that we go through this is actually a screenshot taken directly from the guide. So this is what the guide looks like inside. And you'll see for each chronic health condition, there is an associated or linked action plan that you can go and take a look at. And so for asthma, that link is going to take you to this example action plan, which actually in this case covers asthma and allergies. One thing I really like about this particular plan, about most action plan templates that you're going to look at, is it not only has information about daily management for this condition, but then also what the response should be in an emergency. So we're going to just take a quick look at some of the other conditions that are covered in the toolkit, as well as some examples of plans that you can find to go with those. So for example, our scenario that we looked at was around allergic reactions. And there are action plans that exist for that again allow you to think about What might we need to be doing daily? Are there things in the environment we should look for? Are there early warning signs? Are there things that help this student to manage to not have an allergic reaction or to manage those on a daily basis for themselves? And then if there is an exposure or there is a reaction, what are the things that staff need to be able to do to handle that reaction, to determine what actions to take next? Somebody shared in the chat when we were talking about the scenarios about some of the benefits of calling 911 and really made some great points there about if you're in doubt, they can provide you with an opinion about whether this is an emergency or not. They're able to assess the child, but there may also be situations in which calling 911 isn't the thing that should be done first. I had a child that had seizures. That was a diagnosed condition for him, and so part of his plan was that if it lasted less than 5 minutes, he just needed a place to rest. There weren't, we didn't need to call the ambulance. But that was for my particular child and was a plan that we worked through together as a parent and with his healthcare provider and with the school and with the after school program that he was in. So it was very clearly laid out what to look for and what to do in an emergency. And so all of these action plans are going to help cover that, how to manage them daily, and then how to manage in an emergency. I wanted to show you this one for diabetes in particular. This one is so comprehensive because I think when you have a child who's diabetic, often there's a lot of things to be considering. And so this one is like 6 pages long. I didn't want to put the whole thing on here and have it feel overwhelming, but it's actually really well organized and gives you places to list medications and supplies, how to plan daily, how to plan if something happens. They also talk about how to plan for things like field trips or unusual events, which can be really helpful. And so just wanted to draw your attention to that. And then there's also a page in there for seizure disorders. And again, this is similar to what we created for my child of, here's kind of the usual plan. Here's an emergency plan. We've also linked here, and you'll see when you check out the toolkit, the Epilepsy Foundation not only has examples of these plans, but they also have a variety of tools that you can share, tips for how to observe and time seizures, things like that. And so if you have children in your program that have a seizure disorder, this is something that you may want to check out. Oops, and because I clicked on that, I am now stuck. So let's see. Okay. All right. And so there, and there are, we certainly didn't cover, all of the conditions that might come up. And so, we, encourage you to reach out to us if there's something you're looking for, to look online and see if there's a foundation or our parents organization for that particular condition and see if they have templates and examples available that you can utilize in your program. So great. You now have these action plans, right? So you've got someone who's diabetic and you've got their action plan, and you've got someone who's got allergies and you've got their action plan. What do you do with them? And so what we suggest is creating a centralized resource. And so that could literally be a binder where all these things live. But maybe, it's been a while since I've worked in that particular setting or been a parent of a child in that setting. So maybe there's an electronic platform where these exist instead, or you found a way for your program to house this in some way that is accessible by staff so they have access to it and they are familiar with it, but also protects that youth's confidentiality, keeps their information private. So we're curious if you'll jump in the chat. Are there things that you include in this kind of resource or binder? We were thinking of things like individual health summaries, action plans, medication administration logs, emergency contacts, permission for consent and care signed by that child's parent or guardian. So are there other things that you've included in yours that you find helpful? Are there other ways that you keep that information together? Do you use a binder, or is there some other way that you keep that information together? So we'd love to hear that from you if you'll chime in the chat. Let's see. And then when you have however you're keeping this resource, we want to make sure that all of your staff know where it is, understand how to access it, and that they know when they might need to take that information off site, like if they're going outside or if they're going on a field trip, and that they are going to have the training to know what is included in those. Yes, absolutely. And we're going to talk a little bit about engaging families in just a minute, because it's important to make sure that parents are getting this information and understanding what they're filling out in their own language, being respectful of their culture. Absolutely. Important to have, oh, I love this. Important to have access even if there's a power outage. So, a consideration that if you are considering some sort of online, people can access it from a tablet or access it from a phone. Do you need Wi-Fi or power to be able to access that? And what is the backup plan for if that goes out? It's a great point. Um, Also, making sure it's consistently updated. We're going to talk about that in a minute too, when we talk about engaging families and youth, about how are you making sure that you have this continuous opportunity to have those conversations, to make some updates. Jaleesa says they have a binder, and inside of it, inside a first aid backpack. So that goes everywhere with staff. So you've really feeding two birds with one seed, I think is the way to say that currently. That you put it right in the first aid backpack. So there's some supplies in there and the binder. That's great. And they have an online database. So you're really, really covering all your bases there. So keep it coming if you've got any additional ideas. And I'm going to get us on. So this was so great because it actually really led us right into our next section here. We've mentioned youth and families quite a few times, and that's because they are the experts in their own or their child's health, and they really should be centered in the planning and decision making. And there's a lot of different ways that you might do this. Building trust through consistent strengths-based relationships, creating welcoming environments that normalize health needs. And so, making sure that parents, when they come in at the end of the day for pickup or for drop off, or they're there for events, that you're calling them by name, you're welcoming them, that you're talking about these things at intake or in planning and doing things. You're mentioning different conditions and how you're able to adapt an activity for kids with different conditions so that you really can normalize that experience. Supporting youth with their independence and self-management and advocacy. So being really thoughtful about how are youth being included in that intake process, in that planning, in talking with staff about how they would like staff to be talking about their chronic condition. Is this something that they would like the other students around them to be aware of? How would the parents and the students like that talked about? We also talked about some resources that exist to help with that. So, for example, I had a friend who had a child that had a fairly serious behavioral health condition, which we're not entirely delving into that today, but the parents felt like it was important for the other students around them in their after school program and in their school program to understand a little bit what was going on. And so they came up together with the student, with the family, for how the teacher and how the other school time providers would talk about that. And the way that they decided to talk about it was comparing it to anybody who has also the flu, and that they would need to take care of themselves, that sometimes there was some medicine that they might take for that. And sometimes also they might not need to just not be in the program for a few days because they were really resting and getting well and getting what they needed before that they could come back. And so that was something that was agreed upon together. So supporting, what's that self-management? How are they going to talk about it? What do they want things to look like? Helping families navigate forms. Somebody mentioned this already. We know there are a lot of forms that come with, any kind of programming. So you're going to have your intake, you're going to have your consent forms. If they have medication, there's going to be a form for administering medication. So making sure that they understand what is the purpose of these, what do they mean, instead of just, having papers in front of them that they're signing. I also think that this is a really powerful way to help families to feel empowered and to advocate for their youth. I think sometimes families that are involved and have youth with chronic conditions are often given a lot of paperwork to sign. They're asked to sign all of these consents to share information. So I think being able to sit down with a parent and say, this is what this form says. This is, if you sign this, this is what you're agreeing to. If you sign this, you're agreeing that we can share this information with all of our staff. Or if you sign this, we're agreeing that we can share information with the school nurse so that we can share information back and forth. But you can write on here if there is information that you don't want to share, or you can write on here that you might like us to share this information in the next week or two to get this all to all shared, but that you don't agree, that you don't want that communication to happen ongoing for whatever reason it might be. And so really empowering families by explaining things in a language that they can understand, that's respectful of their culture, and so that they're able to give input, and then creating ongoing feedback loops so that you can check back in with people. You're having ongoing communications with all families because, as I said, somebody might come into your program in September and they don't have a diagnosed chronic condition, but then the parents realize that they've developed an allergy throughout the year, and you want them to know that there's lots of opportunities that they can feel comfortable coming to you and sharing that throughout the year. So we'd love to know what are some ways that your program already does this. And Kate is also going to share a few things that I see the chat has been going off. So
Chat
Kate,
has
share a few
been,
things
yeah,
with us.
chat has been going.
Yeah,
You all are sharing so many great ideas, and we will capture the chat and share back what
great.
people are sharing because there's so many great strategies here. I just want to point out, Mary, I think had bridged our conversation and talked a little bit about their binders that they have for each child that document all the details related to maintenance, medication, modification. So again, more examples of how to prepare staff in emergency scenarios and being prepared and planning for. I love Krista had a couple comments about doing a walkthrough when parents register for a program, doing a walkthrough for the space and showing the facility and how you do accommodations. And then also having an open door policy so that they can come in to visit and help build trust faster that way. Laura had a very good consideration point that she called out that there is a lot of turnover in outer school time. And I think all of us who've been in the field for a while recognize that. So really thinking about a systemic process so that everyone is continuously in the know of the policies, of the communication and the supports that are needed. And then Cassie talked a little bit about, again, also about trust building with families, so important. Um, I'm reading your starting working with strong relationships with families from the beginning. She shares an example of a new camper with a seizure disorder. And yeah. So, and then making sure that all staff attended a training. And I think one of the things that's really, I want to underscore there too, it's all staff. It can't just be your frontline direct service staff. If you have other staff that are working with youth, volunteers, maybe it's your transportation, your drivers, your food staff, like making sure everyone is on the same page and receiving the same training is another really important something to be mindful of as we try to really create these safe spaces. Keep those
So, oh,
conversations going. Oh, Kristen, you raised your hand. We can unmute you.
okay, great.
Let me do that.
I was just gonna say too, I think a big um I guess issue that we have is that we'll be hiring at the beginning of year and we'll do like our big training with all the safety procedures. And most of those people get hired, but then there'll be a lot of people who come in late or we're still looking for people to hire. And so then they don't get that training on the onboarding. So I think it's important to not just have a beginning of the year training where you share all of these things, but either have like a beginning of the year training that's recorded and it has this information so that if you're hiring people and they come on later that they can watch this or that you just include it into your always like on your into your onboarding.
Mm-hmm. Thank you so much for sharing that because that is actually a great, you guys are amazing. That is a great lead into the next section. It takes skill, right? It takes training. It takes some practice to have comfort with all of these things, engaging families and youth, for staff to feel comfortable to have conversations about somebody's chronic health condition, to understand, how to navigate that somebody might be coming from a different context or a different background. And so I'm curious what all of each of you have done to provide that support to staff to increase their confidence. And so, for example, one that we thought of might be just doing some role plays during a staff meeting. Maybe you just take 5 minutes and give, a little card and have them do a role play just to practice feeling confident having those conversations. What are some other things that you do? And also, I think it's such a great point that often we think about training right at the beginning of the year, but what's your plan for when you have new staff come in? So, is there something virtual that they can connect with? Are you repeating staff? Is there an opportunity to make it part of onboarding? Or, this is might be a nice opportunity for some partnership as well. If you're one program and you have a couple people, turnover coming in throughout the year, and there's other programs near to you that have the same thing, it might also be an opportunity to do some shared training. I know my mom actually had shared with me, she used to run an after school arts program in Massachusetts. And so one of the things that they did was this was in New Bedford, Massachusetts, and their program collaborated with several other programs to do their first aid training and to do some of their other trainings because it helped to have that additional capacity to bring in a trainer. And then they were able to afford to bring in that trainer and also to offer it more often because several organizations were going in on that together. I see Krista sharing in the chat that she likes the idea of role playing and discussing scenarios. Also having family engagement nights where someone can talk about the subject and bring activities to do. That's great. And let me see if there was anything else
Yeah, I
that I
think Mary
Yeah,
shared a
please.
scenario. Yeah, Mary shared a really powerful scenario. So thank you for sharing that, Mary. That builds off of Krista's comments too about how to also empower your other youth to be, able to be responding to an emergency, to have the knowledge and education to be prepared to do that, and how important that is when, as Krista points out, when sometimes our group ratios are 1 to 15, there's not one educator can do everything. So how do we empower our other youth to be there as well? And so thank you, Mary, for sharing that scenario. So powerful of how the other children really assisted in the crisis there.
And then it looks like we've got someone else, Jaleesa, who's talking about facilitating role playing during workshops. They actually have a nurse come in and train staff frequently throughout the year, especially if a new student starts, along with the child and the parent at that specific program. So thank you for sharing that. So it sounds like a lot of you are already doing a lot of these things. And so this is exciting to hear that there's quite a few things that you can already build on. And so we are going to use annotation here. If you click on the little pencil at the bottom of your screen, or you may have to click where it says more, it will say annotate. It should bring up a little toolbar. Kate found it. It should bring up a little toolbar across the side or below. If you click on this check mark, that is going to give you a stamp, and you can pick any of these stamps you like. Kate picked the heart. I'm going to pick the star. And then you'll be able to click to stamp anywhere on the page. And so what we'd like to do first is to have you stamp on which of these things do you feel like you're already doing well. So maybe my program already does really well communicating with families and partners. And so I would put my stamp there. And we also regularly get together after something happens to talk about how it went, if we need to make any changes in the plan. So I'm going to put a star there too. So I'll give you a minute here. We want to hear about all the things that you feel like you are already doing well.
As people are navigating to the annotation tool, I want to highlight, because this is how it is for me, that your controls may be at the left of the presentation, but only appear if you hover. So move your mouse, your cursor over to the left-hand side of your Zoom window, and the pen icon should appear.
Thanks, Kate. And also, if you're, oh, and Danielle said she's having trouble finding the pencil. I'm sharing, so it might look different for me. Kate, do you have, what does the finding the annotate button look like from your end?
It just appears. You have to hover. So if you don't have the pen, you can just put your ideas in the chat too. This is
Great,
just for
thank
fun.
you.
So if you're doing something
Yeah,
there that resonates with you, pop it in the chat.
awesome. Well, I'm going to give it another minute because they're still coming fast and furious. This is exciting. This is great. We've got folks that already provide clear policies. We have people that are doing scenarios and role plays and drills. Systems for documenting updates. That's come up a couple times today of making sure not only that you're doing this at intake or early on, but that there's a way to continually update it. This is great. All right, I'm going to ask everybody now to pause and hold your annotation because I'm going to clear all of these and we're going to do this one more time. But now, what I would like you to think of is where are the areas that you feel like you have some room for improvement, or there's some room for some innovation or thinking at your site about how you could do this better. So now you're going to put a check on all the ones where you feel like there's some opportunity for improvement. Great, thank you for sharing. Oh, I love that someone found the question mark. That's a great stamp for this activity. All right. Still got a few coming. It looks like they're fairly spread out between all of the different things, a lot of the things that we've talked about today. All right, anybody got one last one they want to get in here or share in the chat? Oh, and thanks, Danielle, for sharing in the chat. They offer regular staff training and could improve staff confidence. Great. Thank you so much for sharing that in the chat. All right, if everyone can hold their annotation, I'm going to clear this and I'm going to turn this off here. Whoops, let me do that again. Where did it go? Oh, I love that big red arrow. Okay, but I'm going to clear this for now. And I am going to hand it over to Kate to help us think about some additional resources that we can access and some time for reflection as we come near the close.
Yeah, that's great. And it's interesting to see folks reflections on the second annotation to see, how think about how we can all be collectively doing more trainings and building staff confidence. Is going to lead into our closing here. So thank you. So we know we're giving you a lot of resources today. So all of the links and all of the materials will be sent out following the webinar, including this list of additional resources. Can you imagine we have more to share? But we do. And because we're funded through the Centers for Disease Control and Prevention, we have great partners through them as well as through their other partners that bring us so many great resources. So this is just a couple other ones to put on your radar. The America Camp Association has wonderful resources for thinking about planning for health, chronic conditions management, especially in summer camps, so during summer day programs. And what we've learned is that you can sign up in the first year of membership is free. So you can have access to all of their resources for a year free. So if you haven't checked that out, we encourage that at least to dip your toes in and see all of the great resources they have there that might inform your own work. I recently came across this Oregon Healthy Schools emergency guidelines. This was a project of another CDC funded project through Healthy Schools that developed this they thought it was a need for their schools in Oregon. But I will say it is so applicable to out of school time. It is every medical emergency you can think of. It has all of these protocols and all of these tools and all of these tips that can be put into place to help staff, with training and also with protocols. Someone earlier mentioned a workflow. They have a lot of things in there that kind of also go to a workflow. Like you see signs for this, what's the next step, what actions to take. So highly recommend checking that out. It's very visual as well. Our partners at the American Academy of Pediatrics and the National Association of School Nurses have some great resources for consent sharing, including this implementation toolkit. So we highlighted that for you as well. The CDC has a host of resources on their website. And of course, we have a lot of resources, including our assessment to action guide and workbook, who again, many of you on this call are familiar with. But if you're thinking about putting an action plan into place, this is a good starting tool because it gives you, while it's related to healthy eating and physical activity, there's a lot of tips in there to help you think about developing an action plan. So we can go to the next slide. Thanks, Claire Grace. Sorry. Trip over my words there. We're still annotating, which I love to see. And then, we would love to hear from you. If you want to share in the chat, what is something you see as an opportunity for improvement or innovation? Maybe you heard a new idea today that you want to take back to your program. We'd love to hear what that is in the chat, and you can share it with others on the call today. And then also, what is one step you're thinking you want to take following today's webinar? It could be checking out one of the resources shared, sharing our resource guide with others on your program team, any of it, checking out the webinar recording and all the great chat transcripts that are going to be coming your way. Share your ideas there in the chat. We'd like to hear what stood out to you. What are you excited about and what are you thinking about as you leave today's webinar? Yeah, thank you for sharing, Krista. Being more intentional about sharing these resources, right? Like, I think that's a really good reflection. So bringing awareness. I'm going to encourage folks to keep sharing in the chat, and Claire Grace, we can go to the next slide. I know this is an active chat group, so I'm hoping to see some more ideas about next steps and ideas that you're looking forward to taking away from today's webinar. Yeah, sharing more resources. Ooh, creating policies. Like to see that. And creating a plan. All right, yeah. So having a emergency workbook and then having a plan to consistently update that. So lots of people have some ideas spinning. It's great to see those and hear those. And as I said, and Claire Grace said at the beginning of the hour, we do really value your input. And so we do have a feedback survey. Bianca's going to post the URL in the chat. This really helps us communicate both to our whole program team that design and develop these professional development and trainings for you all, what's working and what areas we need for improvement. It also really helps inform us what you all need and gives us a sense for what we can create to continue to offer these professional development and training resources to you all for free with support from the Centers for Disease Control and Prevention. So we do really ask that you just we're going to end and give you 3 minutes back today. So please take a minute and use those 3 minutes to give us your feedback on today's event. We really, really appreciate it. I'm going to go to the next slide. We have some exciting things coming up that I want to highlight. And again, you're going to get links to all this in our follow-up, but we have a webinar coming up on May 21st, so not too far away, and that's all about building sustainable partnerships that deliver healthy outcomes. On that webinar, we're going to be hearing from the Illinois After School Network and the Bright Promises Foundation. We're going to be utilizing their long-term partnership as a case study to talk about how to build partnerships for sustainability and for capacity building for your healthy out-of-school time programs. It's going to be a fantastic event. I really encourage you to sign up for that and join us in about a month's time for that, or 3 weeks rather. And then we also have a newsletter and as well as a healthy out-of-school time champion series. And I would be remiss if I didn't highlight that we have a number of our healthy OST champions on today's event. I've seen Carla and I've seen Krista. So we have a national platform through our partners at National After School Association to spotlight the great work you all are doing in out of school time. So if you're interested in being featured at a healthy out of school time champion, we encourage you to submit your story. And we love to spotlight your work. So that's an opportunity for you as well. And I just want to say thank you all. I mean, the dynamic chat and sharing on today's webinar was so great. We so appreciate everyone coming prepared to talk, to share, to learn. It's really been a wonderful hour spent with you all. So I just want to thank you all for for your deep engagement in today's event. Look for lots of resources coming your way. And I want to thank my partner here, Claire Grace, for all of her excellent facilitation, and Anna and Bianca for helping us support all the back end work. And we're going to give you all 3 minutes back so you can go give us your feedback on today's event and hopefully get a little bit of a break in till the next thing. So thanks, everybody. It was great to see you all. Thank you.